Hello everyone, my name is Irene Msonda. I am an MBA Finance student at the Commonwealth University of Zambia. I will be presenting my thesis or research which is on brain drain in the healthcare and education sector. My research topic is Zambia's depleting workforce and analysis on the immigration of talent in the healthcare and education sector. Brain drain is a serious challenge in Zambia's healthcare and education sector. The country experiences shortages that are due to healthcare and education professionals migrating to work abroad. So one of the shortages that it creates is the one doctor attending to 12 patient ratio. Another ratio we can look at is one teacher attending to 60 pupils, which is very common in rural areas. So this shortage is something we need to really look out for because it compromises the quality of service that is being delivered by these professionals. Another thing that we need to look out for that is caused by brain drain in this sector is economic growth, because if the quality of service that is being provided is not up to standard, then the economic growth will be compromised, as well as the national development goals might not be achieved if brain drain is left unchecked. Okay. So the aims and objectives for the research were to identify the primary push and pull factors that are driving this brain drain, and also assess the impact of brain drain on the healthcare and education sector. So another aim of the research was also to offer recommendations based off our research discovery, and these recommendations would help us have practical strategies as well as put up policies that can help retain these skilled professionals that are living in Zambia. Okay, so the methodology for the study, so approach that was used was a mixed method approach where you utilize qualitative and quantitative data. So a questionnaire was put out across, and this questionnaire had closed-ended as well as open-ended questions, and we got 90 respondents from both health sector as well as education sector, and our respondents were from both rural and urban sector. When it came to quantitative analysis, we used Excel, and for qualitative analysis, we used thematic analysis to the open-ended responses from our respondents. When we look at the results of our research, we discovered that 58% of our respondents considered leaving Zambia in the last 3 years. And from the 90 respondents that we had, 87% would consider immigration if given the opportunity. So that is, if an opportunity came right now, even if they did not have any intention to leave, if the opportunity came for them to leave or to leave Zambia and work abroad, 90%, 87% of them would opt to go and work abroad. And one of the main push factors of this is low salaries, poor working conditions, lack of career growth. The main highlighted countries that our respondent would prefer to go to if the opportunity arose was the UK, US, as well as Canada. So how do we mitigate this brain drain? One of the recommendations to mitigate the brain drain is to implement competitive salary structures that are tied to inflation. And this is because most of the skilled professionals that we have that are in this sector work for government, and government does not evaluate its salaries on a regular basis. And the other recommendation is to invest in modern infrastructure as well as tools in this sector, because you find that because healthcare workers and workers lack the tools that they need to work efficiently, you find that their service delivery is compromised. Another recommendation is to enhance rural hardship allowances and incentives. So currently, these are being offered, but an enhancement would definitely go a long way, as it will also mitigate any inflationary factors that may have risen. The other point is to create career growth opportunities, mentorship programs, and scholarships, so people can be motivated to further their studies in this sector. Another recommendation is for us to draw knowledge from people who've already left, or from people who are currently working in the diaspora, but they help us come up with better strategies that can help us retain the people we currently have in country right now. Okay, so that is it for my research. Thank you very much.